Okay, so I think it's working. I think it's going. All right, so I think it's good. Um, hey everyone, my name is Storm Chandler. Um, if you're new, welcome, and if you're returning, that's great. Welcome back. Um, I'm 46. I'm in Tucson, Arizona, and I have previous experience in animal behavior and forensic pathology. Um, so I had posted on my Facebook page that I was going to do another video. This one might be a tad more involved, just simply because I want to be very careful, very mindful, very specific on kind of the way that it's worded, because I don't want anyone to take anything that I say kind of the wrong way. And it's meant to be helpful, it's meant to be constructive, and I don't want to muck it up. So, one of the things that came up was someone had asked, are people with NPD or those with very difficult, personalities, are they aware of it? Are people with NPD aware of the fact that they are NPD? Um, and it's kind of hard to give a clear cut answer on, because, as always, let me clarify, I'm not a doctor, I'm not a psychologist, I'm not a counselor, I'm not, someone in the psych field. So, if you have really in-depth technical questions, uh, more of intellectual information that you want to gather about someone that you know or someone you're dealing with, that's in that loose category, you need to see a psychologist or someone who specializes in normal behavior, because I preface all of this on my research and my reading and my experience, that what I went through with my NPD person, and so there's that. Um, the other thing that I want to clarify real quick, because I'm going to touch on it, but I want to say things like clinical depression, serious self-esteem issues, uh, core value beliefs about yourself, uh, you know, heavy things that weigh and push down on you. Definitely go get somebody to talk to. Definitely go get a professional to talk to. There are people out there to help with stuff like that. And the reason I kind of disclaim that is it's a 50-50 thing. Um, Roughly about half of people with NPD, once they reach adulthood on some level, they know they're NPD. They've had failed relationships, they've had failed marriages, they've had, failed job after job after job after job, whether, they're being told that they're difficult, the problem is with you. You need to go see somebody, something's not quite right, you don't respond to things correctly. And so, usually at some point, at least once, they've run into a situation where a professional, and again, that's the thing, a professional has said, you possess narcissistic traits, or you definitely suffer from some form of NPD, and that information is, professionally relayed. But because they're NPD, or because they have NPD traits, they're not opening to really hearing it and doing anything about it. And so it makes it very difficult for them to get long term help and to treat. Not because there's not help out there, but because they are not liking the diagnosis. They're not being liking what they're being told. And I have sympathy for the fact that that would be a hard thing to swallow. If you were to go into therapy and someone saying it's you, it's not the world, it's not your family, it's not, you know, due to other outside, it's you. That's a very difficult pill to swallow, proverbially, and I can understand that. But in trying to bridge that gap to get them to a space to get help so that they can work it out to become better, first they have to be able to hear it. And to be able to hear it requires setting down your ego, which is kind of the short version of the problem, which is their ego, their sense of self, to set it down long enough to get help and to listen to a professional say, this is what you need to do. You need to learn to be present. You need to learn to be mindful. You need to learn to count to 10 before you respond to comments. You need to learn to find constructive things to do with your time. You need to learn to be empathetic. You need to learn to be sympathetic. You need to learn to give a little bit reasonably, and so on and so on, right? In a positive, healthy, safe way. They're able to, over a period of time, become better. But there's, the other large chunk of them, percentage wise, a very large number of them that don't want to hear it, that don't want to see it, that don't think that anything's wrong. Um, the doctor's wrong. The doctor's not well educated. He's just guessing. The doctor's having a bad day. The doctor doesn't like me. You know, a good number of them, from what I've gathered, in some situations are usually court ordered, or it's a matter of divorce counseling or divorce therapy. You know, or some of them were pushed into it by a spouse who said, something's definitely wrong. You need to go talk to somebody if we're going to work on this, if we're going to, work this relationship out. And so, again, it's that bridge of being able to get them into a receptive space to hear it. Because until they get into a receptive space to hear it, they're not going to hear it. They're going to take it as yet another attack, even though it's not so. Um, Now, again, because a lot of their issues are tied with ego and self, um, depression and the risk of suicide and self harm behaviors, addiction behaviors, whether it be, to drugs, whether it be to sex, whether it be to attention, whether it to be, any number of vast categories of things, because that's generally indicative of those with NPD. And every person and situation is different. But as a general, rule of thumb, there's usually also something else in there that they're using to supplement to deal with what's going on in their head because they're avoiding it. They're avoiding it because they're not ready to deal yet and they don't want to hear it. Excuse me. And so, a lot of the time with people with NPD is, even if they're intellectually on some level aware of it, um, they'll play dodgeball. They'll play dodgeball with the truth. Um, oh, I suffer from PTSD. I suffer from general anxiety. I suffer from, childhood trauma. I suffer from childhood abuse. I suffer from past sexual abuse. I suffer from an abusive parent or a family member. And I want to be very clear when I quantify this, because those are serious issues. Those are very serious issues. And, you know, that stuff needs to be dealt with in therapy, because if you don't, it's just going to cause problems later. Um, and, the thing, though, is with a lot of them is that they're smart enough to weaponize it. It's not a thing of you and I sitting down on like a second or a third date going, I want to take things slow. I've got some abuse issues that I'm working on. I've got some trust issues that I'm working on. I need some space. I need some time. I need to take my time getting to know you, and having that, be an honest, intellectual, calm, rational, discussion. Um, they end up truth bending, because they know on some level that they've been told at one point or another, or because of their past experiences, many, 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 many past experiences, that something is up or something's not right, and they don't want to hear it. And so they use other things to try to cover the truth about them being um, a narcissistic personality or somebody with highly narcissistic traits. And so it becomes a shame blame game to where they're trying to tone down the truth so that you don't see, because again, there's that self ego and the fear of being judged and the fear of being criticized, that they don't tell you the truth. And so a lot of this is supplemented into also manipulation. It's not just always a thing of shame or being embarrassed. It can also be weaponized. A lot of them will use their truthful, sad backstories. The majority of people with NPD, as children, the majority of them were traumatized in some major, severe, wrong, very illegal way over a long period of time. It's usually long term abuse that sets them up to be this way. So they're not able to communicate and be honest with you about it. And so it becomes a series of where they're using it as an excuse or as a weapon. Um, if you try to confront them about it, a lot of times they'll call you out. You're just making stuff up. You're just pulling stuff off the internet. You're playing, Dr. Phil, and where you're talking to them about, I read this magazine article and I was kind of concerned. Maybe you should see somebody because this sounds, dot to dot to dot, a little bit like you, and I'm worried. And it can become a whole shit show because they're worried about being found out. And, they can use manipulation as a form to make you feel guilty. And if they can make you feel guilty, because who wants to be the guy to make somebody that's been abused in the past as a child or as a teenager, who wants to be the one to make an adult feel bad for things that happened to them 20 and 30 years ago, right? I mean, I don't want to be that guy. I'm fairly sure you don't want to be that guy. you know, let's not push the issue. Let's not upset them. You know, where you tiptoe around it, it's eggshell walking. You start cutting them slack and you start cutting them breaks. And instead of being what you intended, which was to be sensitive and to be kind and to be understanding, they then take advantage of it. It then becomes a weapon. Oh well, you don't understand. You weren't abused, and you don't understand what I grew up in, and you don't know what it was like, and all this other stuff. And so all of a sudden, then it kind of turns where they're using it in a way to make you feel guilty, to invoke empathy, to invoke sympathy, so that you don't have these conversations and confront some of their shit. So they turn it around and make it about you. It's deflection. It's deflection and guilt. It's deliberate manipulation. And so you have to be very careful in dealing with somebody who's kind of victim oriented and victim shamed. Because if someone's not having an honest conversation with you after a certain point in a relationship about their dramas, their traumas, their feelings, how they feel about it, and they're just kind of stonewalling you and avoiding the issue and playing dodgeball with you, and they don't ever uh, you know direct it in a healthy way, where you're getting answers and things make sense and you're communicating, um, and if they're not willing to take that into a therapy setting, that those are red flags, because you're being manipulated by somebody else deliberately with the purpose of, you know, abusing you. And that's what they'll do. They'll set it up where, unfortunately, the abused grows up to become the abuser, and their abuse becomes an excuse to do it to you. And it's because they haven't worked out themselves their stuff. And so it's a cycle, and it becomes a lifelong repeating cycle where no matter who they're with, as soon as the fun wears off, as soon as the novelty wears off, as soon as you're not interesting anymore, they drop you and then they move on to the next one. And the whole cycle repeats again, and it can, go into decades, a lifetime. A friend of mine that was a psychologist told me that, she was working with a patient that was in his 70s. He started therapy when he was in his 50s, 20 something years of therapy, and he still doesn't get it. He still doesn't see it. He's still, doing the new person every couple of months dating. And then when he gets bored with them, and when he's done with them, and when it's not fun and interesting and exciting, when it's not all about him anymore, he just drops off the radar and moves on to someone else. It's a long time pattern. Um, and until they choose to break that pattern, that's how they live their lives. They go through their lives using people. And so you have to be really careful with what you share and how you share information with, someone with a very difficult, high conflict personality, or someone that is NPD, because they file things away to weaponize. And us as healthy or mostly healthy adults, or those that are, working on improving themselves, I know I am. I know I'm not perfect, but I've learned now the hard way that victim stories, past abuses, past traumas, past problems, those are things that need to be talked about, and they need to be talked about early. And if someone is not willing to share with you, that means they're not over it, they're not through it yet, and it might be a good idea to just kind of politely smile and keep moving, because the situations can turn. If you've got someone that's inviting you into therapy and wanting to talk to you about it, and to open a dialogue and to open a conversation about it, and being honest and communicating, I think that's wonderful and that's great. But, be aware that they traditionally, on some level, know, at least in one point in time, or have been told in their adult lives, that they're, you know, highly narcissistic, or they definitely, from a clinical standpoint, have NPD. And these things are usually tied to other comorbid conditions: dysthymia, depression, addiction, sleep disorders, eating disorders, um, sex addiction, alcoholism, porn addiction, and so on and so on. It's tied to other unhealthy things, because that's kind of the only way that they know how to cope, and that's the only way that they know how to find control. And so, by being able to control those things, it makes them feel better about themselves. So, until they're able to get into therapy and to take their therapy seriously, to deal with some of their issues and their problems and dramas, they go on abusing one after another, after another, after another, after another, after another. It's almost serialist. And so, that is not to uh, make light of abuse. That is not to make light of abuse issues. Um, there are lots of horrible things that happen to us all, myself included. I know some friends of mine that have endured some, really hardcore mental, emotional, physical, sexual abuses and traumas over the course of their lives. But they're not mean. They're not abusive. They're not usury. They're not, um, you know, people that would do that to someone else. There's plenty of people in the world that have had bad things happen, and they go on to live good lives and to be happy and learn to be content and well adjusted and productive and all that good stuff. So their abuse is not a it's not an excuse. Um, so that's kind of the short version of that. They're aware, but they're not aware. And it's usually a thing of they're aware or they've been told and they just don't want to see it or hear it. And so until they're ready to see it or hear it, the cycle just continues. It keeps going on for as long as they allow it, or as long as you allow it, or for as long as I allow it, until they either get bored and move on. Um, so that's just kind of the short answer to that. A lot of them will also intellectually use their diagnoses to manipulate. I've already touched that on already. Where some have the attitude of, well, it's a medical, diagnosis, where it's a psychological diagnosis from a professional, and then they begin, because it has to do with that sense of entitlement, that unfair sense of entitlement. Well, I'm NPD. That's just the way it is, and you have to accept it. No, I don't. No, you don't. You don't have to accept it. You can do something about it. You can get into therapy. You can read books. You can do practice exercises. You can do what your doctor tells you. It's not a thing of where, well, this is just the way I am and this is just the way it is. No, it's not. They have to do the work. They have to want to get better. So, radical acceptance in this case is not always the best thing. I know some people have that opinion, and if that works for you, that's great. But for me, having learned the hard way, radically accepting someone with a severe, type of a personality disorder is not me playing radical acceptance to it is not a solution. I'm not going to, when you can do something about it. There's therapy, there's books, there's self-help, there's, plenty of people out in the world that are willing to, on a professional basis, that are educated and trained to deal with these things, teach you to become better. I don't believe just radically accepting it is necessarily the best way to go, but that's just my opinion. I know a lot of people that are married that have gotten married. I read articles and stuff about, NPD. A lot of them are married. A lot of their spouses are aware of the fact that their spouses are difficult personalities or NPD, and they just accept it. They just, go with the flow. That in their mind, that's just who their loved one is, and they're okay with it, or they're making do with it day to day. Um, and if you can make that work for you, if you're happy that way, more power to you. But I don't think it's necessarily a healthy situation to be in. But that's just my opinion. You have to do what you think is best for you. So that's kind of the question that I got was, are they aware? Um, and I wanted to touch on how that is in part due to manipulation. Some of them know that they're narcissistic, and they will use it to manipulate you. That's just who I am, kind of an attitude. Or they'll use their other comorbid factors to their psychology to excuse it. Well, it's my PTSD's fault. It's my anxiety's fault. It's my, there's always some other crutch's fault except their conscious choice. They don't want to be held liable for their conscious choice. It's always something or somebody else's fault. A lot of scapegoating. And so that's what it is. They're aware, but they're not aware. Um, and you being on the receiving end of it, you just have to decide, okay, is this just how it's going to be? Or, do you, or Are you going to work with them to get better and make them do better and to encourage them in a more positive direction? Or are you going to walk away? Um, Me, and for my situation, it was very hard, but I made the choice to walk away because I don't want to live my life like that. I don't want to live my life with drama and chaos and fugue and lies and deception and deceit and always peeking over my shoulder and who's on their phone and who's in their email and who's calling and who's writing and who's texting. Who are they, screwing behind my back? Uh, that just wasn't for me. Uh, so, you know, um, but yeah, that's that. So, this is one of the last videos that I'm going to do on the subject for a little bit, just because the holidays are coming up, and I don't want to crap on anyone's like holiday cheer and whatnot. But that's the short answer to that. Again, if you're experiencing depression, holiday depression, seasonal depression, um, if you have abuse issues that you're working through, find a professional, find somebody to talk to. There's plenty of help out there. Please use it. Please get it. I don't care if it's a 1-800, phone line for somebody to talk to once a week. Uh, Please get help. There's help out there that can help you through this. There is a brighter other end to it. But please don't let people use their stories, their abuse stories, their bad traumas, their bad childhoods to abuse you. So that's all I got to say on that. Um, I'm going to hang out for a bit longer and crash. So I wish y'all happy holidays though and stuff. Be careful, be safe. Please get vaccinated. Please talk to your doctor and get vaccinated. Um, this winter is going to be bad, and I would really hate to see any more people be lost. So if you're eligible, get it. Peace.